And welcome to the Shatkin First Monday Morning Minute.
Good morning. My name is Dr. Tom Spulecki, and welcome to the Monday Morning Minute. I've been an associate dentist here for about 4 years now, and today we're going to do an implant placement at site number 3. This is an area where we had previously placed implants. I had one that didn't give me the good feedback that I wanted, so we let him heal for a few months, and we're going to place another implant today. So I'm going to take the healing cap off of the implant that's in there. And we'll double check that that looks perfect. And you let me know if you have any discomfort. Any pain when I knock? When I push? No, it looks pretty good. The gums look great too. So we'll start you with some topical. Remind me, any allergies to any medications? Any antibiotics that you can't take? Penicillin, okay. And you've never had any issue with our numbing, correct? Okay, good. And slow, deep breath. So I'm going to give you a couple minutes for that to kick in, okay? And then the plan today is once we get the implants in, we'll take a scan, make sure it looks good, make sure it's the right size. And if everything looks good, we'll have you leave today with healing caps, just like you did before, okay? So a lot of times when I'm placing implants, I use my left hand to hold the ridge. It's a little bit harder with posteriors here, but sometimes I can hold my hands, my fingers on one side, and it'll help me line up and find the center of the ridge. So here, I'm gonna have Dwayne open real wide as you can, perfect. And again, any pain here? No. And again, go ahead, open real wide, perfect. Our implant is going in. Dwayne will be done in just another couple seconds. Good. And once the implant is in, I often will knock. So in this case, I'm comparing the sound to an implant that's been placed and been in his mouth for now many months, maybe 6+ months. And it kind of sounds like knocking on wood, whereas an implant that is in soft bone, or maybe not as tight or strong as it could be or should be, will sound a little more thuddy, and it will feel soft, and often it'll move itself. I'm going to advance it just a little bit more for restorability. Go ahead and bite for me. I'm looking for occlusal clearance, thinking about how much of the implant and the abutment is sticking out of the gums, making sure I can take a good impression for a permanent crown. And I think this one looks good. As far as a temporary, we'll often do healing caps, and so we'll try to place 2 healing caps. Sometimes if the implants are too close, we'll do shims and healing caps, or maybe even 2 shims, so that we can protect the implants and relieve as much pressure as we can. So why don't we try healing caps first? There's one there. So sometimes what we do is we can actually trim the healing caps so they still engage the mini implant abutment. And we reduce some of the width. In this case, why don't we do a shim? They're a little close. And then when you leave today, you'll have a temporary made out of composite. So just like we had done before, it'll be something that's covering the implants, but it's going to be left out of occlusion, so you won't be able to bite on it, and it's going to protect those implants, okay? Cut a small one. Should be good. Good. I'm going to keep everything dry. And obviously open just like that. I'll take a mirror. Thank you. And bite for me. Perfect. And you can bite again. And open. So my expectation for post-op is that you'll be a little bit sore, and I think you're pretty aware of what it feels like to have an implant placed. Tylenol and ibuprofen, whatever you normally take for relieving pain, I think will be sufficient, but maybe 24 to 48 hours of soreness. You should expect it all to settle down by the end of the weekend. If you have any questions or concerns, again, I know you've been through the process, but don't hesitate to, reach out to us, okay? If you have any issues. And you shouldn't really feel it when you bite, so you should kind of feel like when you came in today, okay?
That's when you feel normal, I didn't even did now.
Perfect. And then we'll get you back in for a post-op in about a week,
Okay.
and we'll take our final impression probably in about a month, 6 weeks, okay?
Okay,
All right?
thanks a lot.
That's all I've got for you today.
Good morning. We hope everyone had a wonderful holiday season, and we hope that 2025 is your best year yet. We want to take this time this morning to thank you all for working with us at Shatkin First. Dr. Shatkin, myself, the entire team is so grateful to have you as not only friends of our company, but great, great dentists that are on this ongoing educational track with us. And we're privileged to be working with you. Thank you all very, very much. We're so excited to hear about the year 2025. We're going to start off the lecture season in February, and it's a Friday and a Saturday. It's going to be February 21st and February 22nd. We're going to have an intro course, and we're going to go back to basics, and it's a great idea. If your staff's not up to speed or if you have new staff members, bring them on down, and we will talk about how to implement mini dental implants and mono implants into your practice. It's going to be an absolute phenomenal course. So keep in mind, you get 16 CE credits for both days, and it's a great, inexpensive way to collect CE that you may need. And then in March, we're going to have our advanced mini and mono implant course where doctors who have had some experience placing the implants can come out and learn even more. One of the days we'll have Dr. Gordon Christensen lecturing, and he's a firm believer in mini and mono implants and all types of minimally invasive implantology. We're excited to work with everyone. I'm speaking on behalf of Dr. Shatkin, our doctors across the street, Dr. Jared, our staff here at Shatkin First. We look forward to 2025 being your very best year ever. And if you ever need anything, please remember that you can call us anytime, any day, and we're here for you, okay? You can dial 1-888-4-SHATKIN, or you can visit our website at shatkinfirst.com. I hope you have an unbelievable year placing mini and mono dental implants and being a close part of Shatkin First. We look forward to seeing everyone here in Buffalo in the near future, and have an awesome week, and we look forward to seeing you on next week's Monday Morning Minute.